We will get Thank you. We'll get started. And I just want to thank you all for joining us today and for this exciting webinar series. My name is Kim Mayo, and I am a program specialist with the DRCHSD program, which is providing today's webinar. This is the first webinar in a 5-part series that Legato will be presenting for us. We're very excited about this webinar series. We hope that you can make them all. We know life happens, so the webinar today is being recorded, and we'll be posting it to our website as well. So if you haven't already, we would ask you to take a moment and use that chat box. Just get familiar with that chat box. We'd like to know your name, where you're from, and what you do there. That really just helps us to know who's joining us today, here from the center perspective, but also our presenters as well. We do encourage you to use that chat box for questions or discussion anytime during the presentation. If anything comes up and you have a question and you don't want to forget it, feel free just to type that in there, and we'll relay that back to Brian during the presentation or at that time of Q&A. We also would love to hear from you, and would love to see you. So if you have the opportunity where you can unmute your camera or turn your camera on, and if you, when you do have an opportunity to speak, if you'd like to ask a question or have some dialogue with us or Brian, feel free to unmute your microphone. If you are not speaking, we do ask that you keep that microphone on mute. That really does help to cut down on any of that feedback. All right, Brian, we can go to the next slide. This is our funding statement and slide. So the program, the DRCHSD program is funded by the Federal Office of Rural Health Policy in the collaboration with the Delta Regional Authority. All right, and on the next slide, I'd love to introduce our speaker. So Brian Lonnie comes to Legato with decades of healthcare communications expertise, most recently as the Vice President of Brand Strategy for Previa Health and HSS Eastern Wisconsin Division. Brian has been an active participant in the AMGA Leadership Council. Over the years, Brian has combined his creative skills with business leadership as creative director and agency owner. All right, so for today's, this is just a brief overview of today's agenda, and Brian will go over more of those aspects. But today, basically, we're going to look at the 2020 Customizable Communication Toolkit that Legato Healthcare Marketing created for the center and for our cohort members. And we'll be looking at the different campaigns in that customizable toolkit. And we'll also take a look at that in our HA Rural Vaccine Confidence Initiative. All right, so before I turn things over to Brian, we're going to ask you a few pre-polling questions. So Caleb, if you're able to turn those polling questions on, and if you guys can answer the poll, and the first question is I am, and then you give yourself the ranking of confident, somewhat confident, neutral, somewhat unconfident, or unconfident in my understanding of how to communicate my rural healthcare organization's educational opportunities and services. All right. And then we have one more question, I believe. And question 2 is, I am blank in my understanding of how to communicate messaging regarding vaccination confidence. All right, and as you guys are completing those, I will turn things over to Brian.
All right. Thank you, Kim, and also Caleb, for allowing us to be a part of this again this year. As Kim had mentioned, this is actually something we were involved with last year. We did a series of webinars last year, covered a lot of subjects. We're going to touch on a few of those this year too. We're going to obviously be dipping back into some of those that maybe you didn't have a chance to see, so we thought it was important. And we also heard from a number of people that that they wanted to hear more about certain subjects. Just to give you a highlight before we go any deeper into this, what you're gonna hear coming up in the weeks to come are, next week is going to be talking about building your reputation, so reputation management. That's internally, externally, but also digital. Then we're going to be going into building loyalty by targeting various generations. We did touch on that last year, but we're going to talk a little further about that with somewhat of that, getting your message to the correct generation, and also looking at it as communications internally to multiple generations of your staff. Another part that we're going to go to is strengthening physician relationships and building a referral network. That is the fourth webinar in the series. And then the final one is going to be a development piece, that being elevating the role of communications in your organization. This was one that we did touch on last year, but again, we had a lot of requests asking if we could go back to that again. And for those that hadn't seen it, it's a great opportunity to learn more about that. So that's what's coming. But obviously today we're looking at toolkits. Toolkits, the first portion of this presentation is something that we did present at the end of last year. So I'm briefly going to touch on that. And again, this is for individuals that may not have had the opportunity to see it, or maybe the timing wasn't right. So it's time for a good refresh of what is available to you. So the Resource Center does offer a communications kit online. We were selected to partner with them this past year. Actually, it went up further than this past year, for the development of a number of templates. When this started, we were, obviously in the early stages of COVID. So the toolkit expanded as time went by. It initially touched on a series of 4 campaigns, and then we added a 5th one, that being vaccine education and confidence at the tail end of that. So with it, as I said, we launched it with just 4, but then we added that 5th one. It is a toolkit that is available online. I have the link at the top in regards to within the Resource Center website, that if you look under, if you just go there searching the site, you can find it listed as one of the communications toolkits. But it is a very easy to use navigational structure that you find the tools that you're wanting, and you basically download them. And so what I'm going to do is I'm just going to touch at a high level on what's available, and then show you the ease of customization that you can do internally with this. So just kind of providing a shortcut. The templates that are available, it's a wide variety of items that are available for each. It's not, the list you see on screen does not mean that every campaign is every one of these pieces, but they do have a number of them. The core pieces that are probably part of all campaigns are print, radio, posters, with that some website landing copy, social media content. So these are pieces that, as I said, with each subject that are there, but there are certain subjects that get additional support tactics based on the need. So probably the best thing to do to get a capture of what this is, within the landing page, there is a toolkit user guide, and I encourage you to download that if you have not seen that. It takes you through every single one of the campaigns, tells you what's available within that, on that, and it gives you some tips on how to customize, and does a much deeper dive into what I'm presenting to you today. So the first campaign was confidence. It was really building the confidence in your healthcare organization, the trust and the care that you're available within the community, that personal connection within this of the compassionate care. Now, this has obviously been one that organizations that we have heard from that have downloaded this, it was the perfect opportunity to reconnect with their communities, to say, it's time to re-engage for your care. Some of the content they ended up readjusting a little bit in regards to the copy itself, so that it could connect closer with the communities or relate better with the offerings of specialties. At the base, they would update the specialties that were available, and going to the point of actually placing the photographs of individuals within their organization at the top. So that's one thing to remember, The photos that you see here are stock. You can use them as is, or when you go in to download, you are able to update the imagery, update your logo, the call to action, the services that are available. All of that can be done, and I'll show you how that is done later. The second campaign was based on prevention. So within that was focusing on screenings. Again, trying to take on that preventative approach. And I think what we saw, this was an entry point to re-engage with patients, your own patients over this past year for the individuals that were using this. Encourage them not to skip those important screenings of mammograms, colonoscopies, and then also re-engaging with an older audience with the Medicare wellness visits. Encourage them to actually, as we said, take your health in the right direction with that free and easy visit. I think for that, again, it's getting them into the system of this and obviously identifying potentially additional support needs that are needed, or identifying some areas that you're like, you need to start doing this to get your health back on track. So the campaign itself was built on statistics, that being we're focusing on colon cancer, focusing on statistics around breast cancer, and then obviously Medicare wellness, getting the support of what that is. Now, obviously the American Cancer Society, we do indicate the notes in regards to the age 45. Some organizations still are honoring more of focusing on the age 50 within the first campaign. So these are things that, again, you may decide you want to customize. Again, support pieces going with this of digital media, posters, other elements like that for each one of these. The third was swing bed or transitional care. With that, shortening the distance between healing and home. I think it says it straight out what that means in regards to the headline. This was one of the more popular campaigns that people were downloading. That I should say this and the confidence campaign were probably the two largest in regards to the reaction that we had seen. This was less traditional. Yes, we did print advertising for this, but then we also provided some tools in regards to internally how you educate that referral source and providing that information of FAQs, and also even for something that you could provide to caregivers that may be making this decision for the patient in regards to entering them into a transitional care program or a swing bed program. Again, same type of customization being available. And the fourth part of the original toolkit was the telehealth. For many Delta organizations, you were dabbling in telehealth right when we started this toolkit rollout and really starting to launch your own. It obviously took a curve in regards to, hey, this is a great idea, maybe that this is the way we are going to re-engage during COVID, how we are going to connect with our patients, whether it has to do with primary care. Some organizations looked at it as being something that they could manage care through, or being physical therapy types of pieces. So making that connection, and again, through this, being able to show the virtual care on screen, the tip off of the side indicates just that. We can actually, the way that we developed the actual ads, the photographs on screen can be customized, or you'll be able to drop in your own providers on those screens. So again, it's the faces, and I think for communities, that was very important, especially when you were dealing with technology. Who am I talking to on the other end? Do I want to commit to something like this? So being able to make this available, again, within the communication pieces, not all organizations were offering the same types of services within this. So we wanted to make sure that your organization could customize this with the services that were being made available, that the content could directly place your name into this. And then also, we also recognize not all products are the same. So it's not like we could put a generic statement out there of how to use it, because you may access a telehealth product differently. So some of the support pieces for this include a brochure for the patients that, again, offers kind of an area that you can then customize that talks about, how do I sign up for this? How do I connect with this? But at least the core, the wrap around it, we kind of done a jump start for you to help you out a little bit, because believe me, I know you got a lot on your plate right now. So the piece that was added as we were going along, and actually even before we launched the toolkit, we recognized vaccine confidence was something that needed to be addressed. And we, on the front end, worked with the Resource Center doing quite a bit of research of how did we want to approach this. We were looking at a lot of national data that was coming through the CDC and other organizations. We're also looking at really each one of your states, what information was available within the Delta region that you had access to? Were there gaps within there? I think what we were finding, again, was that many organizations were just passing on the CDC information. And what we were hearing through the research was there was a lot of distrust about that information. Not to say it wasn't accurate, but it was government information being told to individuals that this is what you should do. And with that, I think it really came down to that through the conversations with the Resource Center, we determined that it was time to just provide the knowledge. It's encouraging people to make their decisions, because you each need to make the right decision that's for you. But it's our responsibility to give you that information. So with that piece, the 3 words were decided upon, which were learn, understand, and decide. Copy on screen, you probably can't read that, I know that, but with it, it was kind of touching on, and the message, even though time has lapsed, the message has been pretty much the same, is that come a long way since COVID-19 threatened our health and disrupted our lives. As we move forward, we have a shot for a healthier tomorrow, but many of us still have questions. The COVID-19 vaccine helps your immune system defend itself without using the virus or risking an infection of the disease. Getting vaccinated protects yourself and others is an important decision to help end this pandemic together. So that was the core message. With that, what's been provided within the toolkit is a little bit different than the other pieces. We do have a listing of resources that you have access to that was part of the analysis that we did, really looking at what was available across Delta states and other states for vaccine communications. We also were indicating that you needed to have facts. So we actually put together a facts brochure that you can download. Now, obviously, some of the facts you may find that you're like, no, I'm not real comfortable with that fact. Again, you can customize the facts. Some of the facts obviously need to be updated more recently. And I think that's a piece that we do have to have some conversation with the Resource Center, that we go back in and do that. And we're actually, when I introduce the NRHA toolkit, we're in the process of updating those based on some recent or upcoming changes that are occurring in regards to vaccination. But it does come down to, are these some of the same facts that are coming through the CDC? Some of them are, but we also look at, we have to think about rural communities. We have to think about the voice we're using. We also have to think about that, again, these are ads that are not coming, or communications that are coming from the CDC. We did provide you, as part of this, again, social and digital media. So you can obviously add to the communication pieces that you're already probably placing out there through social media. Again, providing you with a little bit more pieces like that. And again, this is customizable, that feature the faces of your community. Talk to the community partners that you have. See what you can do to expand that. So that is really the core of the 5 sections that we did with the Resource Center toolkit. And again, we can get, if you do not have the address to this, we can get you the address. I added it to the PowerPoint today. I was like, oh my gosh, we don't even have the address in the PowerPoint. So we'll make sure that that is sent back on to you so that you have access to this cool toolkit. On screen, I know this may be like, oh my gosh, what is this? But it actually is something pretty simple. This is Adobe Acrobat.
Hey, Brian, before we move there,
Yeah.
Patty Welch has a question.
Yes.
She's mentioned in the chat, so I would invite her to unmute if that is okay with you. And also I'd like to let everyone know I did put the direct link in the chat.
Perfect.
So Patty, would you want to ask your question?
Yes. Okay. So, I mean, I know this is my same Delta Health group that I'm used to seeing. And I'm just a little confused, Brian, on how you fit in here, because does this mean everybody on this call has the vaccine confidence grant money that we got through HRSA for the $50,000 for rural health?
The HRSA grant money, that is not something that I'm involved with that. We do
Okay,
recognize.
Theirs is called vaccine confidence grant too. So I am looking. Okay, so I thought I could network with some of these people on that if they're involved now, because we got that for our rural health clinic, as did one of our providers. Okay, but you just did all my work on my rural health grant ad, so thank you very much.
Well, and I think on top of it, what you're going to see is the resource center, or I should say, what I'm going to introduce next was introduced at the NRHA conference in September. It's an expanded campaign on this. It's still based on confidence. So when you look at the two campaigns, they actually can be worked together.
That's what I was wondering.
And there are organizations that we've had conversations that have started to use these that are using their HRSA grant monies towards that. So they're using it for media placement. But what they see is just like you're saying, heck, I got a jump start right here. I don't have to, I can use those dollars, I don't have to think about the investment of those dollars to be going towards the creation of communication pieces. Now it's more the implementation.
We actually, we created our own ad campaign called Mince the Myths, and we had different providers take the myth that bothered them the most, and we put our local provider's name, picture, and then they dispelled the myth. But I mean, it didn't look anything like this. This is great. So I'm sorry to interrupt. Well, so and one thing I get confused about, and I know I'm sorry, y'all, I just asked the questions. One thing I get confused about, Kim, sometimes when we do this stuff is like how y'all all fit in together. Like, so you're with who, Brian?
I am with Legato Healthcare Marketing. We're located in Green Bay, Wisconsin.
Okay.
We have partnered with the Resource Center about a year and a half plus. And we are with that. It's the goal of providing your organizations with education. And that was really the core of it, to say, we understand that for organizations like yourself, you don't have full marketing teams at times, or you don't have, but you do need some guidance, even down to the basics of how to develop a strong communications plan, how to really look at, again, some of the subjects that I talked about earlier that you need to be thinking about that could be outward facing or it could be inward facing. How do you organize, things like, what are the most important services that you should be communicating in your communities? Those are the types of educational things that we looked at last year. So it's not just all about pushing out, here's an ad or here's a radio spot. We're touching on strategy, things like that I think, even as whether you're a CEO or you are a communication expert, or somebody that's just wearing an extra hat that said, this is your responsibility right now. We're trying to help you with education with this, to provide you with some background.
And those are, I mean, who do have experience with ads or whatever. I mean, we just don't have the time. So this is amazing.
Exactly.
So I'm sorry, I got one more question. And so basically you were already hooked in with this group and working with them. It's just now you've added vaccine confidence ads because you've always done the other ads, like on mammography or whatever.
Yes.
Was I the only one confused? I'm sorry.
No, Patty, I think you're right on. So this these campaigns, except for the vaccine's relatively new, but the other campaigns, they launched right when your cohort 2020 was onboarding. So it was kind of going simultaneously. So you might have gotten the messaging, but not really understood what it was. So that's why, as we presented this fall the webinar educational series, that we hit up on that. We start from the basics of where we started with the campaigns and just doing what Brian is doing, this high level overview. So you're not really behind at all. And it does make a lot of sense that this is maybe new to see you because we haven't really presented it in this manner. It's just, we've maybe sent emails, we've talked about it, but until you really see it, it helps. That's what really helps to tie it all together. So
Yes.
you're right on track. And yeah, and thanks so much. Ryan. And
It's just confusing. I'm sorry. Okay, I will not say another word.
No. And
Yeah.
I would say, if you do have questions like that, and if it does require a deeper conversation, I would reach out to Caleb and Kim. And if we need to coordinate a secondary call to go deeper into the toolkit, we can do that. Or if you want to show it to someone else within your team, we can coordinate time to be able to do that so that because as I said, last year, we spent an entire hour on just this campaign. So,
Okay, I'm sorry.
yeah, no, so it is definitely something that we would welcome, just to help you out so that we can take it deeper. And as I said, there are times that you're going to be like, boy, I wish I could show this to somebody else on the team that actually it relates to, and we can take time to do that. So, okay.
And it is being recorded as well. So
Yes.
you can go back and always, rewatch or share with someone else. But
Yeah.
absolutely. Thanks, Ryan. I'll let you.
Yeah. So on screen, this is what it looks like if you were to go in to customize it. Basically, there are areas that we have. You don't have to memorize this. This is in the user guide. It takes you step by step through how to do it, what to click, where to access it, elements like that. So, and again, it allows you to customize the areas you want to customize. We do within some of the pieces, they're locked because some of the information is considered, that information is core. So we don't want to make changes to that. So, but for the majority of it, you can adapt it to your organization. So the next piece, as we go on, is what was introduced, as I said, in September at the national conference, NRHA conference. This is a grassroots initiative that NRHA had seen what we had done with the Resource Center, what I introduced. And they wanted to expand upon that. And actually the Resource Center was part of that, encouraging, saying, okay, let's see what we can do to keep building the communications on this, take it to a larger audience and expand what is there. We didn't just say, okay, let's do a bunch of more brochures and things. We actually looked at it and said, okay, if we were to take this one step further, what would we do? And really, it's to expand the strategy itself. Look at something that's a partnership with the community. Look at something that your organizations, and we say the CEOs, because it is something that we want it led from the C-suite, to partner with local businesses, churches, nonprofits, and really to focus on that increased confidence. Many of your organizations have good relationships, strong relationships, long-lasting relationships with businesses, faith-based organizations, non-profits, elements, etc., within your organization. That's what we want to take advantage of. It does build on some of the things that we talked about in the previous one. We looked at the Kaiser Family Foundation did research, and they did hone it down to rural also. And as part of that, we really did, in some ways, it reaffirms some of the direction that we were going within. Again, it was, where are you getting your sources of information? It does go down to some of those names or organizations that I listed just a minute ago. And it's families and friends, obviously. But what we wanted to do is to be able to take that, evolve the messaging a little bit, and still do it something that's an easy to use resource. Focus on the caring that you've always done, but encourage individuals, again, that you need to make the choice, but base it on facts. Base it on facts that are based on rural also. So it was a 3-tier approach. We look at, obviously, the hospital and the clinic, including staff, local businesses and community partners, and then the community overall. And then looking at ways we can just push information out to all of those. If we break it down into those 3, hospital and clinics, start out with. CEO is the community champion. So that's a new title. Obviously, you're getting rid of the old title. You're now the community champion. But within that, it is we do feel it is important that we understand you got a lot on your table. You are going to need help from other people within your organization, but we want to make sure that the relationships that those key leaders of your organization have, that's your strength. And we do need the voices of these organizations on the outside to come together to build that confidence in your community, to strengthen that confidence, to step forward. The messaging that you have internally, as we were building this, obviously there were federal mandates that were coming out. We had to obviously shorten this in regards to what you can do internally. We do feel communication is extremely important of whatever you're doing, that you are keeping your organization aware of every step you're taking, because above that, there are some within your organization that are probably on the line. Do I want to be vaccinated or not? You have the cheerleaders that do. And we have that these individuals need to encourage others and encourage patients to be vaccinated. So within that, we are providing tools to you to be able to, like a PowerPoint template that you can constantly update to provide information. Internal communication pieces that are available to share with patients, patient portal information, emails, even just as people enter the doors that they see information that can be shared, which I'll show you in a bit here. The business community partners, again, the community champion reaching out to those local businesses. And when we see that, obviously you see the picture of a restaurant owner. It could be restaurant, it could be the chamber, it could be a manufacturer local. Really looking at maybe some of these organizations you've already, like manufacturers, it could be something that you may have connected with them with vaccine clinics already. But helping with that, continuing to provide those organizations with more education. And I'll show you pieces with that we're going to do that. With that, really thinking about that those businesses can help you with their customers, and their partners can help push this message even further with their brand associated with it too. The community, outward facing. Again, it comes down to give them the education, give them the facts, and letting them make that decision, but having it push through. Again, this is where it goes a little bit deeper, the nonprofit faith, those leaders within the community to help educate within it. What is it that we're sending them to? What's the call to action? It's a little bit like what we were doing with the previous campaign. We're saying this is your website, and we most likely you all have COVID content on your site. I would encourage you that you don't just bury this within the rest of the COVID content, that there's a dedicated page, whatever your URL is, and then /fact check. This is key, that every piece of information that goes out has this information on it. We're encouraging people to go to this, to go to your site to get this information. You are the experts within this, but at the same time, it's being talked to in the voice of your community and in the voice, a rural voice. It's not coming from a government organization, like I said previously. This facts we are giving you, we will provide you, or you can download within this a complete list of facts, which, as I said, we will be updating in regards to booster shortly. We will be updating also in regards to 5 years and above, but it will be something that is a living and breathing document that you can go to. You don't have to use all the facts, but this is a comprehensive list. I may be able to, Kim, Caleb, now that this is launched, we're starting to see organizations use this on their site. So I can probably give you a link that you could share to show how organizations are using it. It is rural focused. This is pretty much touches on this. Everything that we're doing is rural focused, but we also want to make sure the diversity is there. And with that visually diversity, that you could use the stock images if you want to, or you can do the customization if you want to. We also, a number of the items are being provided to you in Spanish. So we're taking the legwork out of that. If it is a core piece of communication that you can just take and run with, it is most likely available in Spanish too, that you can download. So when we look at it, the core of this is based on beliefs, the whys. To the right is an example of a print ad or a poster. It's really talking about, for an individual, and we have about a dozen different ads that are available within this, that what's important to them and why they did this. The copy itself obviously is more of a storyteller type piece that allows you to place your name into it. But this is also a jump start for you that would say, you know, I like the concept behind this, but I want to feature somebody within our community within this. And we also have made it available that the name is not there. Within the templates, it'll say type name here, things like that. So if you want to actually use people that are within your community, you can. But otherwise, it can be done just in the way that it's seen, that it's just a general person and that's it. Again, it allows for the logo updates, indicates that knowledge is power, but we're pushing them at the end of get real vaccine facts at your URL / fact check. So it's really every person has a story. And as you go through it, the series, it can be individuals from your organization. We've noted like the Hispanic version that we're tying into the Tyson factory, the manufacturing factory. So the voice is not just coming from you. You're joining forces together to say, this is important to all of us. It's talking to the fact of families, and then it's bringing it down even from a digital media standpoint and providing you the templates within that show the faces of a coach within the community that people know that has agreed, that says, I want to be an outward, I want to be a voice for this. So you're not on your own. And it's really touching on the small town values that each of us, you know, that we're aware of within this. It's not a big city health system. We do look at, and again, this is a snapshot of a lot of things that are available. In-hospital educational posters, direct mail pieces that I realize you can't target an unvaccinated patient, but you can look at this as addressed to someone that lives at this address, giving them the facts, just a short sheet of facts, and then driving them to the bigger facts. Educational presentations that you can use in the community, or you can use when you're bringing a business on board to saying, we should do this together. Things like door hangers that are much more grassroots. But then it's not just, let's just do this. We're giving you the user guide again too. So that for the CEO or the others involved with this, you have a user starter kit guide that takes you through the steps of what to do and how to use it and all the elements that are involved. The core piece, again, as I said, it's within the website, but it's also available in a printed piece within that. Hospital and clinics, as I noted, have the posters, the patient portal messaging, direct mail, website landing page content. The businesses, as I said, PowerPoint to educate their own employees that allows them to place their logo into it too. FAQs. I think that's a piece that you're going to go out there and you're going to like, community partners are going to be like, why should I even do this? We're giving you some backup to that are a quick, at a glance, two-sided sheet that provides FAQ that you can, as a leave behind, or you can use it as a talking tool with those partners. Idea starters. Again, it's a piece for these employers to say, here's some ideas that you can do with your employees, or you can do with your customers, or others that you connect with. Again, a tactic guide, the brochures available, obviously the posters are available. And again, to the right, it just kind of shows the idea of what can occur within co-branding that's there. And then the community. This is where you're seeing a lot more diversity in regards to the communication pieces. Each of the print ads that we're sharing with you, and the posters and the brochures, door hanger, radio scripts, it's all available in English and Spanish. Radio, we do have 3 scripted pieces that are available. Digital media, social posts, we do have a handful of social posts and imagery that's available to you. And then we have a piece that's kind of nice with this. I'm not going to play it through here because it's going to jump and skip through Zoom. But there's a multimedia video that it's less than 2 minutes. And it takes on the Believe theme. It can be used for social media. It can be used within your website within that. But it really is almost like a rally cry around, we need to believe in this and you need to get the facts so that you can make the right decision within it. And then ultimately, the final piece of this is the presentation that can go to the community, that you can, not just you can take it out there, but it can be a tool that a church could use or an educator could use to be able to provide information to the community itself, to educate and provide that. I know that's a lot. So I didn't touch on this on the first or the first part of it, but what do you need to have to be able to do this? Within some of the core communication pieces, Microsoft Word is the basics of it. You know, things like scripts, social media posts, landing page content. It's a cut and paste for you, that you take this information and adapt it, utilize it the way you need to. Adobe Acrobat Pro is what you would need to be able to customize the PDF templates. So basic Adobe Acrobat, you can view, but you can't customize the content. So you would have to actually subscribe to a pro version of that. It is pretty affordable and it is very easy to use. And as I said, as long as you have the instructions, it's very easy to use. The reason that I've noted Creative Suite is because some organizations do have access, or they have communication partners that are using Creative Suite or InDesign or Photoshop, elements like that. The files that are available within the Resource Center, or I should say within NRHA, those core community files are also available as packaged files that can be used if someone has this higher level design access. So you have access to that, or whoever is using it can download those files. So they're zipped files that you have everything you need to work from. So really, I mean, the bottom line is that for success, again, I reiterate, the parts that have to be there is really the buy-in and the leadership of the CEO or key C-suite individuals to really be able to implement this toolkit properly. We are seeing the success of this right now. Right now we have it's a rural hospital in North Dakota that is now taking this. They are actually expanding upon it, which is great to see that they are. They've identified business partners. They've identified individuals in their own organization that they are going to take photography of. At the same time, they're going to do two different ways of capturing of videos of their stories of their whys. Why did they do it? So it's taken beyond the print. Initially, they're going to do it just as almost like, using their phones and being able to post that through Facebook. Just short clips, but with those clips, they're able to have another voice and hopefully spread confidence that and it takes a lot to step forward for some people to say, I'm vaccinated and this is why. But it is doing that and getting those people to believe in that. And then secondly, they were already making arrangements to shooting some bio videos for their website. And they said, okay, we're going to do the same thing. We're going to expand the series within that and capture that. So they're thinking beyond. And then there's another organization we talked to that said they're going to take it to outdoor to expand the concept within that. But it was enough, much like, as you said earlier, it's a springboard. So it could be everything you have that you need here and you can go with it, or it's enough to just at least give you a jump start in the direction. The other piece that I keep going back to is make sure you have that fast facts section on your website to provide education, some sort of destination, and don't pack it within your COVID information that you presently have. The URL, this is the other URL that you would go to. And again, we can get that to you in regards to that is the toolkit for NRHA. It downloads pretty much the exact same way as the other toolkit. So that's how it works. I know that's a lot. So I know I rattled through it. I should have got through pretty fast. So, but I'm just hoping, as I said, we're all, is it going to change everything? Prior to this call, I was on the phone with NRHA, and we're just to give you an idea, is that a lot of this had to do with communications with the CDC. CDC is aware of both of these packages that are occurring at the moment. They have been brought in, they know what's happening, they actually like the direction in which this is going. They know it's not going, you're not going to all of a sudden flip and go to 90%. They're just looking for some little action in the needle that it's shifting, and what is working and what is not. The elements that are within the NRHA pieces, we're going to be monitoring that within a few organizations and just trying to see what makes the needle move. I think this is a piece that, as the education, is it going to happen within a month? No. But we are going to keep monitoring this. I think it's a piece that, for Legato, it's our responsibility to keep the resource center informed so that you guys know what's going on, and be able to expand that if there are pieces that end up being something that we're seeing great success. And even just the whole campaigns, what communities are seeing success with it. So I think I will stop talking here and answer any questions. Well, obviously you have the poll question first. I don't know if you want to go through that first, or you want to go through questions.
Yeah, let's go ahead and run through the polls so we don't forget. Yep, Caleb's going to pop that up. And so it's kind of the same questions. Just we want to know about your understanding we want to know about your understanding and how to communicate my rural health organization's educational opportunities and services. All right. And Brian, we do want to thank you so much for just sharing this great information. And we do have some questions as well in the chat we'll get to.
Okay.
All right. And then as you guys have already, second question, I am blank in my understanding of how to communicate messaging regarding vaccination confidence. And then that last question is, I am, and you fill in the blank there, that I will apply the knowledge gained from the educational training to improve my organization's community outreach and education efforts. All right. You can share those results. Oh. I'll let Caleb run the polls. As folks are finishing that, so one of the questions is, could we use Microsoft Publisher when you were talking about the different options for editing?
Right now, these are not built in Publisher, so you would have to go through Acrobat with that still. So yeah, we had not taken it to that, transferring it across that platform. So.
What about, this one was also asked, do you have any current data on this campaign? And I'm assuming that was the last one?
No, not yet. Meaning the NRHA campaign, we do not have current data yet. As said, it just launched. It's probably it's a little over 3 weeks ago. So we do have what we want to consider. We consider them beta hospitals that have agreed to provide us with baseline information. We are going to be meeting, they basically are, and when I say baseline, it's both internal and community-wide vaccination rates. And then also having open-ended answers and questions throughout the process. And we meet with them monthly to have that. That information is the information that, as I said, is being passed on to the CDC. That is going to be something that's going to be going for, 6 months, 8 months, it's just going to keep going. So as we start to see returns of that, that's what I was saying. We will share that information with the Resource Center so that they have that data. Maybe it's something that we actually just apply to the page itself too, so that you know what has been happening with this. So unfortunately, too early.
I'm actually the one that asked the data question. Brian, since you guys created the campaign at Legato, correct?
Yes.
Did you guys do any, I guess, your pre-market, I mean, your research while you guys were developing this campaign? What kind of data did you guys collect? What kind of, I guess, research did y'all do? And is that something you can share?
Okay. The research, as I said, that you had that core research that came from Kaiser, but then the rest of it is a combination. I would say it's a combination twofold. It's a combination of conversations with NRHA and their key leads within NRHA. So this is, I mean, if you, Alan, CEO, Brock, and others, we're receiving information directly from them, especially if you know Brock from NRHA. He was a real core in regards to content, in regards to what rural community hospitals, information that he was hearing, and then feeding some things back out to those organizations, just testing some baseline tests. The other piece of it was even our own client base. What we were seeing success within our own client base of tools that we were already developing. Now, obviously, right now, what's occurred is even our own clients are really going, they're using this stuff right now too. So they're just kicking it off over the next couple of weeks, these pieces. So we are seeing action on it. So as I said, some of the core messaging really just came from the experience over the past, since March 2019, of communication that has occurred within rural markets and what's working. So if you don't have the Kaiser Foundation research, we could pass that on to you to be able to get that to you. Again, I can get that to Kim and to Caleb, get you a link to that. So obviously it's now somewhat dated, but I still feel it's very good insights into that. And as I said, it touches not just on rural, but it does get down to the rural level to provide us with information. Another piece that I think you may have it, but if you don't, meaning that it may be available, I'm not sure, Caleb, if this is on your site, but it was something that we worked on initially with NRHA that had to do with FAQs and also how to answer questions. It's not a lengthy piece, but it's a piece you can download, a PDF that has, if you're asked this question, this is how you answer it. And it comes from a lot of different audiences that you're speaking to. So again, I realize it's a dated piece, but it is something that I still think pertains today that would be part of that. And again, I think it's probably a piece I need to talk to NRHA about updating a few of the parts on that too. So I'll get the link to that, or provide the PDF to, again, Kim and Caleb, so they can push that out.
That'd be great. And let's see, Patty has made a comment, such nice materials. Thank you so much. Can't wait to use them.
Okay.
Yeah, it is such great information. Anybody else on the line have any questions, comment? We do have a few more moments. One thing I'd like to just kind of ask Brian, and if you can maybe provide some insight on, so we've got these this great toolkit. We've got these great resources. So what are ideas or thoughts of how can we use these with no budget?
Well, within the tools, as I said, it's not all about, I hate to use the word because I'm not supposed to use the word advertising, but it's not all about advertising. It's about relationships. And within the tools that are there, when we talk education, there is enough education information there that can be passed along to community partners to get that in the hands. We did, and I didn't point this out, we did, when I said, oh, here's a brochure. Well, you're like, I don't have the budget to print a brochure. We actually did develop that piece as a PDF also. So it is something that you can share electronically, or an organization that your partner has, they could send it to their employees. They could push it out to the congregation. They could do whatever they want with it, or they could print it out just on a laser printer. So we try to keep that in mind, that not everything has to have a budget for, oh, I got to have media placement for this, or I have to go to a local printer and print everything at a high-end print, customized print. We wanted to make sure that that was not the case. The radio scripts, you may have relationships with radio stations already that you already have time scheduled or something. Give them the scripts, let them do the reads. You don't have to take it to the point. We did, with one of the scripts, have it written that way so that it is much more of a read. The other two was based on different voices to give you an idea of what could be done. And again, digital media, think about that. You have Facebook followers, so you can speak to your followers already. Yes, you want to push out beyond that, but think about your patient base. Think about those individuals that follow you. Think about your employees. To be able to have that outreach go to them and others without having to spend large media dollars. Yes, if HRSA dollars come through to you, you have to think about your communication strategies about how this fits with everything else. HRSA dollars are not just for this. I mean, it's for a lot of different things that help communicate and build confidence, or bringing vaccine to areas. It could be the purchasing of a van or something that brings that vaccine, or picks up people to bring them to a vaccine site. I mean, there's a lot of different things that people are talking about, but this is a piece that can be part of it, that you may want to support it, even with the basis of photography, or some basic costs that help you make it your own, make it your community, so people recognize people. Better impact, stronger campaign. I know that's a long answer, sorry. So that's it.
No, I think that's perfect. I think that's great to, those are all great ideas and things to really think about, because a lot of times, we just don't have the budgeting, for, these grand things. But, I think you're right on with, partnering with our partners, and
Yes.
just being creative in how we communicate the messages, and just, thinking about it doesn't require, this huge budget. So thank you for that.
Yeah.
Any other thoughts or questions before we kind of wrap things up? So we have next week, same time, same place. Next Thursday, October 28th, from 11 to noon Central. We will have webinar number 2, and Brian and Amy will be presenting on building your reputation internally, externally, and online. So another great presentation as well.
Yeah, looking forward to it. All right.
Yeah,
Well,
and Chase entered a comment here, sharing with the media creations with our local Chamber of Commerce and asking them to share with local partners.
Perfect.
What a great idea.
That's perfect. That's exactly where you want to be. So
Love it.
Good. Well, as said, if you have questions after this, feed it to both Kim and Caleb. Obviously, they can push questions to me, or if we do need to take a deeper dive, I'm happy to just take some time with whomever you want to join Caleb or Kim with you and do that. Otherwise, looking forward to next week, and you'll have me for a couple of these, and then you're going to see a few more legato faces as we go along here. So, all right. Well, you have a good day. Appreciate it.
Thank you, Brian. It's always a pleasure. And we thank you all for joining us as well. And we will see you next time.
All right.
We wish you a great rest of your day. See you soon. Bye.
Okay.